So tongue observation is one of the major pillars of TCM diagnosis, right? And it is quite reliable compared to the pulse, which is not always the case. Tongue observation is based on the following 4 items. First, we look at the body color. The body color indicates the condition of blood, qi, and the yin organs, which are heart, liver, kidney, spleen, lung, right? Pericardium. Hopefully we know that. The body shape. So we look at the shape of the tongue, which indicates the state of blood and nutritive qi or yin qi, Y-I-N-G, yin qi. The coating, we look at the coating of the tongue because it indicates the state of the young organs and the pathogens, right? Pathogens are heat and cold and dampness, etc., etc. Okay, and the young organ, you know what they are. The moisture of the tongue. We want to see if the tongue is dry or overly wet, and that indicates, of course, the state of the body fluids. So this little tongue map is giving you an idea where each organ is mapped out on the tongue. So if you look at your trunk and your own trunk, the heart is at the top with the lung, right? And then the spleen and stomach in TCM represents digestion, so they're in the middle. On the side, we have the liver and gallbladder. And then at the bottom, below the belly button, you have all your other organs. So you have the intestines, the bladder, and the kidney. So it's kind of like representing your trunk with all your organs, right? The heart part is called the tip of the tongue. The lung part is called the front of the tongue. The spleen and stomach is called the middle. The liver gallbladder is called the sides. And the kidney, bladder, and both intestines are called the root or the back of the tongue. As you can see on the picture on the right, it literally separates the lower jowl from the middle jowl for the upper jowl. The upper jowl is the lung and heart. The middle jowl is spleen and stomach and liver gallbladder. Sometimes in some text, they will put liver and gallbladder in the lower jowl. So some students don't agree of where lower jowl and liver gallbladder if they are located in the middle jowl or lower jowl. And of course, the lower jowl is the intestines, the kidney, and the bladder. So the area will tell us what's going on, right? If we have a certain color in an area of the tongue, then it will tell us what's going on with that organ. So let's start with the body color. We said we look at 4 things, so let's look at the first one. The 5 body colors on the tongue are red, crimson, which is deep, deep red, purple, blue, and pale. So a lot of similarity with the body colors, but a little bit of distinguishes, right? So we distinguish it from the body colors. So if we have a red tongue, it is excess heat or yin deficiency. How do we know the difference? If it is excess heat, we would have a coat on the tongue, a yellow coat on the tongue. If it was yin deficiency, we would have no coat on the tongue and it probably would have some kind of crack or dryness. Crimson is that deep red, like a dark wine, red wine, of course. That can indicate fire or body fluid exhaustion. So it could also be that the fire has created body fluid exhaustion, right? Too much heat dries the body fluid. So if we see this, how do we know the difference? Obviously, body fluid exhaustion, they'd be very cracked, very, very, very deep cracked in the tongue, which would show like very depleted body fluid. With fire, we would see more strawberry prickles and probably a deep red, maybe a couple of cracks at the beginning, but not that much, right? Purple, of course, is blood stasis. I always say to my students, P and P, purple and pain, represent blood stasis. Blood stasis always creates pain and purple color. Blue or bluish tongue is excess cold or excess yin. And pale tongue is either a qi deficiency, blood deficiency, or yang deficiency. How do we know the difference? If it is a qi deficiency, the tongue is pale. If it's a blood deficiency, the tongue is pale and thin. The shape of the tongue is very thin, skinny, right? If it's a yang deficiency, it's pale and fat or swollen. The opposite. Okay, so qi deficiency is pale, blood deficiency pale and thin, and yang deficiency pale and swollen. Got it? So obviously, if we see red tip of the tongue, that's excess heat in the heart or yin deficiency in the heart, right? If we see purple sides of the tongue, that's a liver blood stasis. Okay? So we always have to look at which area, and we're going to practice this in a minute. All right, so let's look at the color of the coat. We have to look at the coat in TCM. So the first one is we're going to look at the body fluid, right? I was saying we look at the moisture of the coat. So the moisture of the tongue, either it is very dry, which could be, like we said earlier, fire or body fluid deficiency. If it was really, really red, it's probably fire. If it's really, really cracked and dry, really, really cracked, that's a body fluid deficiency. If we have a greasy tongue coating or oily tongue coating, shiny tongue coating, that's either excess damp or excess phlegm. Okay, so it's the opposite, either dry or damp, right? Colors of the coat. So the coat should not have a color, it should be transparent and be a little moist on the tongue, but not overly so. So if we have a yellow tongue coating, that's excess heat. So remember, yellow palms was excess dampness, but yellow tongue coating is excess heat, right? The tongue coating yellow makes a difference. It is not dampness. Yellow coat means heat. Now, if it was yellow and greasy, it would be damp heat, okay? So if the tongue coating is white, the thicker the coat, the worse the problem is, of course. If it's a thin white coat, it's not as bad. That's usually excess cold. Now, if it's grayish or black, it's usually a very serious, deep-seated illness. It could be cancer. It could be something that's very, very deep-seated. So that's something that you have to really send the patient for more tests and look into it very much more deeply, right? So that gives you an idea. So again, you can mix them up, right? So if I have a yellowish tongue coating that is really dry, then that's probably an excess fire, right? Because it's excess heat, the yellow coat, and it's probably a red tongue with it. So that would be excess fire. So let's look at some tongues to kind of give us an idea, right? That's the best thing to do. This is the closest picture that I could get for a healthy tongue because it's pink, it's got a bit of a moisture coat, but not overly so, and it's not cracked, and it's got a good size and good shape. The first one on the top left has many, many cracks, as you can see. This is definitely a body fluid deficiency. I mean, it's really, really cracked, as you can see. It's probably coming from over too much heat because it is red, right? The one on the top right is a little bit more of a yin deficiency. It has cracks already, and you can see this is the tongue shape. We're talking about the shape of the tongue, okay? Remember, this is the shape. So you can see the small cracks. That's a yin deficiency. But having said that, the tongue itself is purple, right? So there's some blood stasis, but the crack indicate the yin deficiency because there's small cracks compared to the body fluid deficiency, which were big, many cracks. Looking underneath the tongue. So on the left here, we have engorged veins. Those are the two veins underneath the tongues. And we actually have two acupuncture points there, right? We can bleed those veins. If they are very engorged, that's a blood stasis. If you can't see them at all, that's a blood deficiency. If you could see just normally a little bit, then that's fine. Strawberry prickles. You can see on this tongue, it almost looks like it's a strawberry, right? Strawberry prickles indicate toxic heat. So kind of raised on the tongue, right? Swollen tongue and teeth marks. You can see the teeth marks on the side, right? You can see this is a really pale, swollen tongue, so that's a yang deficiency, right? Yang deficiency usually creates dampness. So swollen means yang deficiency with dampness. And of course, you can see the teeth marks on the side as well. Teeth marks are usually a spleen Qi deficiency. So this could be a spleen yang deficiency. But it's affecting the whole tongue, and there's a bit of a crack too. Can you see that? So remember, fat tongue, yang deficiency. Thin tongue, on the other hand, is a blood or yin deficiency. So if it's pale and thin, it's a blood deficiency. If it's red with no coat and thin, that's a yin deficiency. And the one in the middle with the really pronounced teeth marks are definitely a spleen Qi deficiency due to stress. The person is worried, overthinking, and they're constantly clenching their jaw, which creates the teeth marks. And the last one in the middle is deviated tongue. So deviated tongue naturally comes out to the side. That is internal wind. It could be a precursor to stroke. but it definitely is internal wind. So that's something to look for, to be aware of, because that could create some more issue.